I'm going to tell the advantage of having a normal lordosis in the cervical spine and in the lumbar spine. What you see on the left, it is a normal alignment at the cervical spine as well as in the lumbar spine. You could see the presence of cervical lordosis and the lumbar lordosis. So this lordosis does an essential job to the nerve system, especially to the spinal cord. The spinal cord is, you see, owing to the nature of the lordosis, the spinal cord is slack here as well as slack here in the cervical and in the lumbar spine. So this slackness of the spinal cord is very essential for the normal mobility and functioning of the spinal cord itself, because it is this spinal cord in which all the 31 pairs of spinal nerves will exit at each level to innervate the segmental areas like muscles, bones, nerves, joints as well as the skin. Now you see the picture on the right. This picture has obliterated cervical lordosis and lumbar lordosis. In some instance, we could also see a reverse lordosis, which is nothing but a backward curvature will become a forward curvature. Now it comes with a cost. What is the cost? That it stretches the entire spinal cord along the entire length. You see the slackness here, which is completely abolished, and rather the entire spinal cord itself is stretched to the length, and this will cause tethering of the dural sheath. You know, when you do slump test, you actually stretch the entire spinal cord along with the dural sheath. That's when it will show up any problem. So in this abnormal posture, what you are essentially doing is you are stretching the entire spinal cord along the dural sheath. So that makes the spinal cord and the exiting nerves very sensitive. So such sensitivity is the one which causes pain even for a slightest input. These people will have so much of pain. This kind of pain is commonly attributed to hyperalgesia and allodynia. Such kind of pains are very common for this type of people, because their nerve system is always angry, always sensitized, always pro-inflammatory, and in such cases these types of people even will be getting fibromyalgia or chronic regional pain type of syndromes. Even though there may not be a disc bulge in these spines, such position of the spinal cord itself due to the forward head posture and then reduced lumbar lordosis posture, the pain can be very much to these patients. So as a therapist, what we have to try to do is to restore the posture back to normal like this, restore the lumbar lordotic posture back to normal like this, thereby at least some amount of physical normalcy you will get in the spinal cord. Thereby the spinal cord will start relaxing, start breathing, and then start conducting the messages normally. If not, the spinal cord will be always agitated, look for an opportunity to produce the pain. Even little bit of sun, little bit of wind, little bit of change of environment, cold sensitivity. So these are all very common nature for this kind of people. So make sure that you get the spine back to alignment. Okay.